Hi, my name is Emma, and I suffer from acne just like you. I enjoy playing sports and hanging out with my friends. I'm pretty busy, which is why I love only having to apply CABTREO once a day. Read the instructions for use before you start using CABTREO and each time you get a refill. There may be new information. This information does not take the place of talking with your healthcare provider about your medical condition or treatment. Before you begin using CABTREO, it's important to remember to apply CABTREO exactly when and where your doctor instructed you. Some important information you need to know before applying CABTREO is that it is for use on the skin only. Topical use. CABTREO is not for use in your mouth, eyes, or vagina. Make sure you read the instructions for use before you start using CABTREO and each time you refill your prescription. There may be new information. This information does not take the place of talking with your doctor about your medical condition or treatment. Remember that you should apply CABTREO to your face one time each day as prescribed. Before you apply CABTREO, wash your face gently with a cleanser, rinse with warm water, and pat your skin dry. Now that you have prepared your face for CABTREO, let's walk through the 4 application steps. First, to apply CABTREO, press down gently on the top of the pump to dispense 1 pea-sized amount of CABTREO onto your fingertip. Note that even though it doesn't look like a lot, 1 pea-sized amount of CABTREO should be enough to cover your entire face. Now, use your finger to dot the 1 pea-sized amount of CABTREO onto 6 areas of your face: your chin, your left cheek, your right cheek, your nose, your left forehead, and your right forehead. Next, you want to spread the gel over your face and gently rub it in. It is important to spread the gel over your entire face. If your doctor tells you to put CABTREO on other areas of your skin with acne, be sure to ask how much you should use. After you have finished applying CABTREO to your face, wash your hands thoroughly with soap and water to ensure that no gel remains on your hands. Now, you're all done. Feel free to watch this video again the next time you apply CABTREO. Some helpful reminders about the storage of CABTREO are to store at room temperature. Do not freeze. Keep it away from heat. Throw away CABTREO that has passed the expiration date. Store the pump upright and keep the container tightly closed. Keep CABTREO and all medicines out of the reach of children. Remember to ask your doctor if you have any questions and refer to the instructions for use. Keep watching for important safety information and how to link full prescribing information, including the instructions for use.
What is CABTREO? CABTREO, clindamycin phosphate, adapalene, and benzoyl peroxide, topical gel, 1.2%, 0.15%, and 3.1%, is a prescription medicine used on the skin only, topical use, to treat acne vulgaris in adults and children 12 years of age and older. Do not use CABTREO in your mouth, eyes, or vagina. Important safety information. Do not use CABTREO if you have had an allergic reaction to clindamycin, adapalene, benzoyl peroxide, lincomycin, or any of the ingredients in CABTREO, or have Crohn's disease, ulcerative colitis, inflammation of the colon, colitis, or severe diarrhea with antibiotic use. Before using CABTREO, tell your healthcare provider about all your medical conditions, including if you plan to have surgery, are pregnant or plan to become pregnant, are breastfeeding or plan to breastfeed, have other skin problems, including cuts, abrasions, sunburn, or eczema, or use other skin and topical acne products that may increase the irritation of your skin when used with CABTREO. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, herbal supplements, and if you take or use a medicine that contains erythromycin. CABTREO should not be used with products that contain erythromycin. What should I avoid while using CABTREO? Avoid or limit your time in sunlight, including use of sun lamps or tanning beds during treatment with CABTREO, as it can make you more sensitive and you could get severe sunburn. Use sunscreen and wear clothes including a hat that covers the treated areas of your skin if you have to be in sunlight. Cold weather and wind may irritate skin treated with CABTREO. Avoid applying CABTREO to areas with skin problems, including cuts, abrasions, sunburned skin, or eczema. Avoid skin products that may dry or irritate your skin. Avoid the use of waxing as a hair removal method on skin treated with CABTREO. What are the possible serious and most common side effects of CABTREO? Tell your doctor right away if you experience side effects, including allergic reactions. Stop using CABTREO if you have hives, rash, severe itching, swelling of your face, eyes, lips, tongue, or throat, trouble breathing, throat tightness, feeling faint, dizzy, or lightheaded, inflammation of the colon, colitis. Stop using CABTREO if you have severe stomach, abdominal cramps, watery diarrhea, or bloody diarrhea during treatment, and within several weeks after treatment with CABTREO. Sensitivity to sunlight. See, what should I avoid while using CABTREO? Skin irritation at the application site is common with CABTREO and may include redness, scaling, dryness, stinging, burning, itching, and swelling. These are not all the possible side effects of CABTREO. Call your doctor for medical advice about side effects. You may report side effects to Bausch Health US, LLC at 1-800-321-4576 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full prescribing information, including patient information and instructions for use at www.cabtreo.com.